All right, well, we're after 1 o'clock, so I think maybe some more people will join, but we've been using the whole hour, so we can go ahead and get started. I think everyone has heard the spiel right by now, but one more time. First, you're going to hear from Lori, and she is going to give a little bit of a background, a reminder of how we got to where we are today. And then you're going to hear from two familiar faces. Brianna and Erica from DHEC are going to share about physical activity in schools and kind of what they're proposing to the Leadership Council. And then after that, we will have some discussion as a group about how the Leadership Council can support them and kind of brainstorm of what that might look like. So Brianna and Erica, thank you so much for your time today. And Lori, I'll turn it over to you.
All right, I will share my screen. Okay, once more for the people in the back. No, we do have different people that are coming to the different think tank presentations. So want to make sure that we're just hitting on this each time. So welcome to our 1 o'clock think tank presentation on physical activity in schools. Just a reminder that we're here so that Leadership Council members can hear directly from the state leaders who are working on this priority, and so we can discuss how the Leadership Council and our individual organizations can help to advance this in our state. And so we're reminding everybody how we got here. So we've got our state health improvement plan, 5-year plan, has a priority area of chronic health conditions, which then has goals and objectives related to that. And Healthy Palmetto has stepped in as the state coalition of organizations really focused on the healthy eating, active living, and healthy weight components of the state health improvement plan. And so our purpose really is to unify and mobilize healthy eating and active living efforts that create equitable opportunities for all South Carolinians to achieve a healthy weight. And so again, we're not an implementing body, but we are trying to put some collective focus on some key initiatives to move our state further faster. The objective most closely aligned with our work is to decrease adults who are obese down to 31.5% is where we're trying to get. And so Leadership Council monitors this data as new data comes available. And so September 2021, we had this new data that came out showing that our current adult obesity rate is now at 36.2%, which is far off from where we want it to be. So therefore, our focus and attention is definitely needed in these areas. In South Carolina, we have, and you'll actually hear about this today, a unique data set called South Carolina FitnessGram System, and Erica and Brianna will be representing the partners that are at the table for FitnessGram and sharing more about that. But it really does provide us some information on our youth in our state that can then be a predictor of what future adult obesity rates, which direction those are going to go. So over the last year or so, we've been looking and taking a deep dive into the Trust for America's Health State of Obesity report, which has a long list of recommendations that states should be focused on to reduce obesity in their state. And so we've taken that list from the long list down to when we left our December meeting, we were down to 13 priorities that we wanted to put some collective focus on. And since then, Kelsey and I have talked with each of the state leader groups and have 5 decided not to go forward with us. So that leaves us with 8 priority recommendations. We will hear from Early Care and Education later this week. Today, you get to hear about how we are the group that's working to prioritize school time physical activity in the state. Got a couple in physical activity in the built environment, one in healthcare. We heard from the 2 nutrition education and assistance state leader groups this morning, and then healthy food systems, the last one. And so this is our schedule. We're about halfway through our schedule. We've got some on Wednesday as well. But today you'll hear Erica and Brianna talk about FitnessGram and really labeling it as FitnessGram. But just want to remind everybody that the actual recommendation is physical activity in schools and prioritizing physical activity in schools. And the groups that of partners they're bringing together around FitnessGram are the partners in the state that are working on this initiative in our state. Okay, so your role today is to put on your Healthy Palmetto Leadership Council hat. How do we collectively unify and mobilize these efforts? your organizational hat. How can your organization play a role? And then any other hats that you might wear, whether it's a task force, a committee, a coalition, a special interest that you have, how do you bring that into the conversation as well? And so as they're presenting, think about what you're still curious about around physical activity in schools in South Carolina and any ideas that this generates for you. So with that, I have the distinct pleasure of turning it over to Erica Ayers and Brianna Mealing, who I might be biased, but I think they're just wonderful people. They work with me. And so I will turn it over and let y'all share your slides.
So Bree, while you're sharing your slide, I'm just going to encourage people, it's after lunch, so I know that. I'm going to encourage people, if you can, if you choose to, stand up. If you have a stand-up desk, this is a great time to do it. I just lifted mine up because I was like, I know I get a little sleepy after lunch, especially after this delicious sweet potato and lentil soup I just made this weekend. And then also, if you're standing up, but maybe you're wearing your pajama bottoms, turn your camera off. It's okay, no judging. Just be forewarned that usually if you're in a meeting with us from DHEC in our division, there may be some physical activity that happens, okay? So, all right, Bree, looks like you got the presentation up, so I'll hand it back to you.
All right, sounds good. Can y'all hear me really well? Just a thumbs up. Awesome. So happy to see y'all. Good afternoon, familiar faces. We definitely are extra familiar today for some of us, round 3 maybe, or a couple of us. So thank y'all for being with us. Glad that y'all are participating in our think tank session. My name is Brianna Mealing, and I'm the South Carolina FitnessGram Coordinator at DHEC. And so today what we want to do is just discuss the FitnessGram initiative. What is it? Why we think it's important, and why we think that y'all should think it's important too, and how it's been implemented over the last few years, as well as some of the successes and challenges that we've seen, and what it is that we're asking Healthy Palmetto today. So excited again to have y'all advance to the next slide. All right, did it move for y'all too? Okay, just want to make sure it's a different setup. All right. So what we wanted to do first is to get y'all, to get started, is to bring your attention to how this aligns with other initiatives in the state. Lori has done an amazing job multiple times today sharing this. I just want to point out one more time on our end that Live Healthy South Carolina, they developed the state health improvement plan, which highlights some specific needs across the state. And so South Carolina FitnessGram aligns with that chronic health conditions portion, and goal number 2, specifically the policies, the systems, and the environment that support healthy eating and active tobacco-free living. And so the objective here is to decrease the percent of adults aged 20 years or older who are obese in South Carolina. And it's important to address this early in childhood and adolescence, because this issue just does not start in adulthood. And let's be honest, y'all, youth don't just suddenly wake up struggling to breathe to go up a few steps when they turn 20. There's a lifestyle and there's a story behind this long before all this happens. So that's kind of what we want to highlight. Healthy Palmetto, they recognize this and has identified the need to prioritize full-time physical activity. And so what I'll do now is just go ahead and turn it back over to Erica. Many of y'all know her, but she's going to introduce herself and talk a little bit about the importance of physical activity.
Yeah, so Erica Ayers, school wellness consultant with the Division of Nutrition, Physical Activity, and Obesity Prevention. And a lot of the work I do is around working with national, state, and local partners to support healthy eating and active living in the school system. So I've been working with Bree along with the South Carolina FitnessGram initiative. And before we get into the meat and potatoes of this, we want to first ask y'all and clarify the difference between physical education and physical activity. And so if you think you know the difference between the two of these, just raise your actual hand, because I know it takes a minute sometimes to find the raise your hand button. All right, so if some of y'all think you know the difference, that's good. Next slide. So physical education is an academic skill-based class. It's not gym. A gym is a room in a school building. And physical activity is any movement that applies the skills that you learn in physical education. And students need both to develop the knowledge, skills, and confidence to be physically active for a lifetime. The way I like to explain it is that you learn the lifelong skills of being physically active in physical education, the same way you learn the lifelong skills of reading and English language arts. Next. So I know we're all aware of this, but it's always good to remind ourselves the benefits of being physically active, especially for students, occurs from head to heart. So this includes improving concentration, building confidence, strengthening muscles and bones, maintaining a healthy weight, improving their cardiorespiratory fitness, your lung and your heart functioning, which is what we're really focused on, boosting their immunity, and at the end of the day, it makes you feel good. And so it's the goal of South Carolina Fitness Ground to help students reach these benefits by supporting their health from head to heart, which is why that's become our tagline. Back to Bree.
All right. So this is just a simplified timeline to give y'all a little bit more history about this initiative for those that aren't aware. So way back in 2014, which really wasn't that long ago, DHEC developed the South Carolina Fitness Program in partnership with the Department of Education through funding from Blue Cross Blue Shield of South Carolina. And so this funding supported the development of this statewide initiative, the system for data collection and reporting. And it also has helped to purchase the fitness program site licenses, as well as professional development opportunities, technical assistance for each of the districts that are participating, and other resources for administrators, for teachers, and also providing a full-time fitness program coordinator position for myself. Thank you. I just also want to say too that this way back in 2014, it started with just 6 schools that were piloted during that year. Now to date, there's over 90% of districts that are participating, so 71 of 79 school districts, which is really exciting. So that's a huge impact of over 1,000 schools and several thousand, hundreds of thousands of students. And so in 2020, DHEC was awarded additional 4-year funding through Blue Cross Blue Shield of South Carolina Foundation to maintain the system and to expand the focus from not just collecting the data, but also using that data to improve student fitness. And so the number of partners working with DHEC directly to support this has grown significantly over the years. Just even from just convening a core team of individuals, like a few stakeholders, to now we have a 23-member advisory council of national, state, and local public health and education content experts. So Erica is going to talk a little bit more about those individuals and highlight some of the things that they've helped to develop along the way so far. And as recently as 2021, and really in 2020 as well, we were able to develop the task forces within the advisory council to help implement some of the communications, outreach, and professional development opportunities. And this is including the recruitment of who we've dubbed our influencer school districts. We'll talk a little bit more about in a little bit as well. And they've helped with providing some statewide webinars and other fitness program needs based on some of the feedback that we've gotten from districts and teachers around the state. So let me move forward. And so what is Fitness Program Initiative? So just a little bit more details to dive in just a little bit first. The Fitness Program system itself is a statewide web-based health-related fitness testing and data management system. And the assessment tool was developed by Cooper Institute as a way to measure student physical fitness levels. And so what PE teachers do, they're able to assess BMI students, cardiorespiratory fitness, muscular strength, muscular endurance, and flexibility. And these are for grades 5, 8 in high school, and just 2nd grade for BMI. And there's more information about all of that too that we can share a little bit later in our website. But what the idea is to get a better understanding of health of students and their risk for developing chronic health conditions, opportunities to create individualized goals and fitness plans, as well as helping students reach their fitness goals and improving overall well-being. So those are some of the benefits to having this system in place. And so again, I would like to highlight that over 90% of school districts are participating in this, which is great. This is a great opportunity. And so as the teachers are able to use this, collect and manage the information, what we have our partners who are helping us to analyze that data and evaluate it to create yearly data reports. And so just in a nutshell, South Carolina FitnessGram, it measures and improves student fitness by working with the schools to enhance physical education and create more opportunities for physical activity, as well as, again, to ensure wellness and academic success of all students in South Carolina. We ourselves have to make student fitness a priority by incorporating quality physical activity at school, at home, and in the community every day whenever there are opportunities for that. And this initiative really does help school districts and communities to provide programs that are proving to work to increase the amount of time students are physically active. And I just want to show y'all a quick snapshot of the annual report I was just mentioning. So this is the 2019-20 school year. Right now, we're in the middle of preparing to publish the 2020-21 school year report. This is just what it looks like. And what it shows is a breakdown of the sample size by region, including the number of districts, schools, and students. So a plethora of information there. And we also stratify the data by student grade, the gender, the race and ethnicity, and poverty status as well. And so at the state level, what the data is showing when it comes to equity and health equity and things, African-American females have the lowest rate of meeting fitness standards, and students who are living in poverty have lower rates of fitness than those that are not living in poverty. So this data has been used to help us select those 3 fluent influencer districts based on to learn how proven evidence-based practices can lead to improved fitness for those students. Okay. And so overall, what that data report is showing is that half of students don't meet the requirements for healthy cardiorespiratory fitness. So our children's hearts and lungs are not working optimally. That's kind of what I was hinting at a little earlier with children suddenly becoming unable to make it up the stairs, breathing hard, you know, all these things. That's just a little tidbit on that. But what we have is a third of students that are overweight and obese as well. That's what the data is showing us. And that there are challenges that students are facing due to the pandemic for being physically active. And so what Erica is going to do is share a little bit more about what we're doing about this data. So I'll turn it back over to Erica.
Yes, so what are we doing about this data? Well, we have a current grant from Blue Cross Blue Shield South Carolina Foundation, like Bree mentioned, is helping us explore how to improve the use of this FitnessGram data from the state level all the way to the individual student level. So what we want to do is create more awareness about the status of student fitness in South Carolina, as well as those proven evidence-based practices that can be implemented to improve it. Again, with that focus on cardiorespiratory fitness. So DHEC's not doing this work alone. We have a core team, which includes our funder, Blue Cross Blue Shield of South Carolina Foundation. So Hannah's here. Our state advisor, the South Carolina Department of Education. We have our national advisor, the Alliance for a Healthier Generation. So hello to Molly, I think she's still here. And Seth Shelby serves in that capacity with us, her colleague. We have our evaluators, the USC Center for Applied Research and Evaluation. And then we also have the USC Children's Physical Activity Research Group. So hello to Russ and his team, and thanks to them for their data analysis for our annual reports each year. Like Bree mentioned, next slide, we also have a larger advisory council, and this includes national, state, and local public health and education content experts who guide the development and implementation of our South Carolina FitnessGram initiative. And this includes the statewide and regional local professional development opportunities that we provide to our stakeholders, whether that's PE teachers or folks in the community or at the state level. And then also we have a South Carolina FitnessGram communications plan to help with increasing this awareness. Next. So this is what we're doing at the local level. South Carolina Fitness Program is working with 3 school districts for the next 2 school years. That's Cherokee County School District, Georgetown County School District, and Kershaw County School District. And they're going to help us identify how schools and communities can work together to use FitnessGram data plus evidence-based practices to increase time for physical activity, increase the intensity of physical activity, improve the quality of physical education, and develop a school culture of health and fitness where it's not just an exception, but it becomes the norm. All of this leading to improved cardiorespiratory fitness of the students. And like Bree mentioned, we're calling these districts our South Carolina FitnessGram influencers because their successes will be shared at the local, state, and national levels to help others in their support of student fitness. So what we're hoping to achieve by the end of this current initiative, I'm not saying the initiative is ending, but this current funding cycle, so the end of the 2022-2023 school year, is to have 80% of more school districts statewide participating in South Carolina FitnessGram. So that means them meeting what's required within our MOA with them of importing the data into the system so that we have access to it. We're also hoping to provide at least 4 statewide or regional professional developments each year on, again, how to use that data, what are those proven practices, what are those connections between the state, the school, the community. We're also hoping that 50% or more of schools within these influencer school districts show improvements in their physical activity policies and practices. And we're using the School Health Index to measure that. And then also we want to see an increase in the percent of students in our overall sample who's achieving the healthy fitness zone for cardiorespiratory fitness by at least 5%. And then on a more of a statewide level, what we're hoping to see, next slide, Bray, is an increase in the percentage statewide of students who are in the healthy fitness zone for cardiorespiratory fitness, an increase in the percentage of students in the healthy fitness zone for healthy weight, and then specifically looking at our second graders, an increase in the percentage of those students also in the healthy fitness zone for healthy weight. Back to you, Bree.
All right. And so here are some of the successes that this initiative has seen thus far. So some successes in receiving the fact that we've received funding from Blue Cross Blue Shield of South Carolina Foundation to build and maintain this system through 2023, increasing and maintaining the number of school districts participating in South Carolina FitnessGram, providing free resources for school districts and the FitnessGram site licenses, testing equipment, trainings, and technical assistance, as well as collecting student health-related fitness data from the state level to the individual student level. We received active support from key stakeholders to make student fitness a priority, as well as securing MOAs from the 3 school districts that Erica mentioned earlier, and publishing the South Carolina FitnessGram communication materials, the logo and the one pages, for example, as well as securing a grant agreement with AFERT to coordinate professional development opportunities. So those are some of our successes. But here are some of the challenges. So although we've received funding through 2023, there is still a need to sustain South Carolina FitnessGram beyond 2023. State legislation with no accountability on or funding support for physical education programs. And for example, the 2005 South Carolina Student Health and Fitness Act, making student fitness a priority while recognizing that there are COVID-19 related challenges that are faced by schools, school districts, and communities. And there's still an interruption in PE programs, fitness testing, data entry, and professional development opportunities that we've seen even through this school year due to the pandemic. So with that, what are what are the asks? What are the 3 priorities that we're addressing that need addressing? Can I say the sentence? I don't know, y'all. The 3 priorities. Okay, we want y'all to join this movement. We need help with those things. I'm going to go ahead and highlight each of them. Okay, so the first being assessment of needs. So South Carolina FitnessGram needs help gathering information from stakeholders some of the folks here, the advisory council, Gayford Advocacy Committee. Another example is from South Carolina Department of Education. You know, the list can go on here, but we need to assess what those challenges are that schools are facing, and what it is they need to support student fitness that can be addressed and supported here at the state level. Okay. And our second priority is advocacy support. So the results of the information gathering portion will inform what advocacy needs exist that can possibly be included in the Alliance for a Healthier South Carolina priority policies. And possibly advocacy needs might be relevant to the South Carolina 2005 Student Health and Fitness Act that I mentioned earlier, and even the Every Student Succeeds Act, and that's bringing awareness to those things, the accountability for those, access to those, to more resources around implementing those, and assessment of PE programs, just to name a few things. And finally, our third priority is communication support. So engaging healthy Palmetto Leadership Council members as our South Carolina Fitness Center champions. We want you all to be champions in this, who are able to share information about the initiatives, this initiative through your networks, targeting stakeholders who are identified by FitnessGram communications plan that Erica mentioned earlier. And information sharing will enhance the awareness of FitnessGram as an upstream initiative that aligns and supports other state priorities. Okay, and communication support can, this can also lead to cross-sector connections. An example up here is school and healthcare systems crossing over, and as well as additional support for advocacy needs and sustainability. So again, that funding and what it's going to look like beyond 2023. So that is all that we have for our presentation. Thank y'all again for this opportunity to share. I'm going to stop sharing my screen and turn it back over to Lori or Kelsey.
Thank you, Bree and Erica, for that information. Really appreciate you guys taking the time and sharing kind of what's going on in the state and the successes that you've had and the work that there is still to do. So would love to hear from our leadership council. What are you hearing that kind of stuck out to you? What are you curious about still? And what ideas did this generate for you? And I can kick us off. I have one maybe clarifying question for both of you. So you mentioned awareness of FitnessGram as a potential ask, like helping use the networks and connections to share. Do you see that being sharing about South Carolina FitnessGram in general, or is it sharing the data, or is it both? You know what I mean? Like, are we sharing, when we share with partners like at a state level, is it helping to share the data that's in our state from FitnessGram, or do you want more people to know what is FitnessGram and why it's an asset and why they should support it, or both?
That's a good question, Kelsey. I would say a combination of all of the above.
Okay.
So there still are districts within the state that may not know about it or are aware and just don't know the benefits necessarily, or even within the partnership that we're talking about that we want to have between folks here and connecting that information across. What does it look like, the awareness of the students' fitness themselves within their own communities, for example? How are your schools doing? Like, what are the kids looking like? What's happening? And how this system is good, just not from just presenting the information, the data itself, but what are we going to be able to do about making changes to just the level of student fitness? So it's really a combination of all of that. There's just, we could talk about that more if there's more details you want me to go into that. And if Erica, if you want to share anything as well. add to that?
Yes, so I put the link to the DHEC Instagram webpage in the chat box. That includes our annual data reports, but it also includes the one pagers that we've recently been coming out with. And those have exactly what you're talking about, Kelsey. We have specific audiences that we've identified through our communications plan. So whether that's agency leads or community coalitions or district coordinators, superintendents, PE teachers, all of that's being created and it's in the one pager, and there's a one pager for each of those target audiences, which specifically has an ask of what we want them to do with the data and with the messaging. And for some of them, it includes the support we would provide for them as well. Like Zach and I were on the call with each other last week, developing the one for healthcare professionals. Misty and I put together one for early care and education systems. So I encourage y'all to go there and check out those one pagers, and we're going to continue to be adding to that list of one pagers. So please, bookmark it and make sure you go there frequently.
Thank you. What other thoughts or questions do we have from the Leadership Council?
I'll quickly chime in. I know I've worked with you guys and I'm pretty familiar with this program, but I, as someone who works like directly with schools and with districts, what are some things that we could do to like specifically help you from the assessment standpoint? Can you kind of elaborate on what you need there?
Yeah, so what we hear anecdotally from our partners at the state level and then the few folks that we work with at the local level, whether it's district coordinators or PE teachers, is that there's this need as it relates to advocacy, as in what Bree showed. There's state legislation, the Students Health and Fitness Act, that's been there since 2005, but there's no funding behind it. There's some lack of accountability for it. So it includes mandates that should provide quality PE programs, but if the accountability is lacking, then it's hard to actually make sure that those PE programs are of quality. And then there's also federal legislation that Every Student Succeeds Act, which is supposed to be providing funding to health and PE programs in our schools. But we know that there's a disconnect happening between the federal level, that funding being piped down, and to the school level. And so we're hearing this anecdotally, but what we need to do is bring together these different groups, our advisory council, the advocacy group for the Physical Education Professional Association, and find and local folks, and find out, okay, what exactly are those needs that we can support at the state level to make sure that y'all are getting the accountability, the access, the resources that y'all need at the school level. Because we know that if y'all have that, then it should lead to improved opportunities for physical activity in the school, outside of school, in the community, and that with that, we'll see improvements in cardiorespiratory fitness. So we need no more anecdotal, we need some cold hard facts, some information. We know that Dr. Ben Medina at Department of Ed is starting to take this on, but he's just one person, and we need to make sure that we get behind him as a unified voice.
Thank you.
Hi, this is Jason Euros with the Kids in Parks program. So congratulations on having 71 out of 79 school districts. That's amazing. And you're working with, from what I understand, the PE teachers in those schools to do these assessments. I also, I guess, would understand that most of these school districts probably and schools have school nurses who could also help to promote cardio, respiratory fitness, and physical activity by writing sort of informal prescriptions for physical activity, in specifically, I guess in my case, outdoor situations where kids would be encouraged to go for a walk. I don't care if they go for a walk on a trail, if they go play basketball on the basketball court, but there's a way for doctors to write prescriptions and school nurses to write prescriptions for students to just be more physically active and more aware of how spending time outdoors may improve their fitness levels, and just wanted to see if you had considered working with school nurses in that way.
Some really good thoughts, Jason. We mentioned earlier our FitnessGram influences school district. Can you hear me well enough? Is it okay? Everybody knows my headphones are bootleg sometimes, y'all. But so we mentioned, and what we have are kind of a variety of folks who are who we're considering our leads that we're working with, who are, you know, kind of overseeing the PE teachers who are our main target. One of those is a nurse, and we've had some opportunities to have conversation with her. She's the district district nurse coordinator for Kershaw County. And we've also had her invite other nurses to come and discuss some things. Now, the specific things that you mentioned, there may be, you know, more opportunity for that. But as far as FitnessGram itself and how to communicate some of the importance of, you know, physical activity, fitness, how to bring all these pieces together, that is new. That's something that we really want to work more on as we're communicating with her. And again, seeing how some of these programs and policies or whatever it is that are proven that work in these districts that were those influencer districts, how all of it kind of comes together. So I don't know if I answered everything, Jason, or if I kind of touched on it. If you have something more specific that you wanted me to, or Erica to chime in about, but we're looking at that and hoping for some more partnerships and communications now and in the future.
I'll just say it's sort of a unique challenge because as Brianna showed, like the lifespan of this thing, there's a lot of really good work happening. But the reality is the pandemic has put a big strain on school districts and schools. And so that has to be kept in mind, but then there's an opportunity in that as well, because when we're looking at mental health and social and emotional health and learning, physical activity could play a really good role in that and be part of the solution to some of the challenges that come with that. And so it is a unique sort of challenge of, you got to be mindful of where people are, but you're also sitting on when we brought together the influencer school districts this past year, they're the ones that are the cheerleaders in the school and like being that social and emotional support and bringing play in, which play is the work of children, right? And so it just is this unique time we're in right now for physical activity in schools and prioritizing that and not coming across like we're not mindful of the other things happening in schools, because it's a lot. It is a lot out there.
I am curious, Erica, to the point about the accountability. And I know in the past, even before I took this position, we had been working on that and discussions around it, and even including discussions with the Department of Education. Have we seen any difference in the last 3 or 4 years on the accountability and the actual reporting from the schools beyond the actual FitnessGram reports, or to address the amount of physical activity that is being actually scheduled?
Well, that's a perfect question because Ben's here now. So that's something that Ben could touch on us. But Ben, just to bring you up to speed. So Ben is not on Ben's on our advisory council, and he's the health and PE contact for Department of Ed. And we're so thankful to have him as one of our partners. But Ben, we shared that our priorities was 1, needs assessment, bringing together SCAPERD advocacy, our advisory council, Department of Ed, not anecdotal, but what are those actual things that can be supported at the state level, specifically as it relates to legislation that's in place, whether it's Student Health and Fitness Act or with ESSA, Every Student Succeeds Act. And then 2, reaching out for that actual advocacy support, because I know that's something that we struggle with, thinking about the people who are involved. We don't always have the capacity to have that voice. And then 3, them being FitnessGram champions. So going back to Meg's question about what's the current status as it relates to accountability for that Students Health and Fitness Act and PE in general.
It's a really good question. Thanks for filling me in, Erica, because I was somewhat there, but that helped greatly. So thank you. Um, as far as where we are with accountability, we have on the books law to have just that. That was to look at program effectiveness of physical education. However, it has for the last 4 or 5 or so years, through a proviso, not been funded. So therefore, we don't have any data to really program in place to collect that data. So where the biggest issue lies for us is, again, that funding. We have it on the book, so that's kind of a good thing that we already have this program there. We just don't have any way to implement it. And there was a program in place before, and it was very cumbersome and tedious for teachers and districts to complete. So I would really love for a new program to be put into place, but unfortunately I can't do it without any funding for that to happen. So part of that is obviously FitnessGram. There is going to be a physical fitness component to any program evaluation process for physical education. So we would need some sort of student performance outcomes, which FitnessGram is going to do, but there needs to be other components to it as well. To be comprehensive enough to actually show program effectiveness. So that, as far as where we stand, I think we're in a good spot from a legality standpoint. It's just a matter of what it looks like, implementation, and being able to fund that going forward.
Thanks, Ben, for your jumping in and just answering questions. I really appreciate you being here and giving us that context. What other thoughts or questions do we have for Erica or Bree, or we've got some other members of their, I think, core team here, or advisory team at least here. So any other questions or thoughts that we can kind of bring to light today? All right, well, Erica and Bree, I think you can take it as that was an excellent and thorough presentation, and and you have done great work in getting to the point that you are today, and we are really looking forward to continuing to work with you and incorporating this as a priority into what comes next for the Leadership Council, and communicating and advocating for this great program. So thank you so much.
Well, we enjoy the opportunity to share, and while we are developing our South Carolina FitnessGram Champion materials, just expect us to come back to all of you with those materials and to give you very specific instructions on how to intentionally share messages and data about South Carolina FitnessGram. And we'll be back in touch. Thank you.
Thank you. All right. We'll see everybody on Wednesday, I think.
All right. Bye-bye.
Bye.